Alright, I'm going to show you how to place an oral airway. And these are really a nice tool to be able to help bag valve mask someone a little bit easier. So if you're finding they're obstructing, you're not getting air in real easily with a bag valve mask, this is a good option. This should be used in general in a patient who is unconscious without a gag reflex. If you try to put this in someone with an intact gag reflex, you may make them vomit, and that could further compromise your situation. Now, unlike a nasal trumpet, you don't usually have to use Sterigel, but it is an option. The important piece to start off with is to assess your size. So there is a range of these. If you're interested in the actual size, like with ordering and that kind of thing, they are kind of imprinted on the very bottom. You can see it kind of, it's hard to see, but that is 90. And they range all the way down to this one here, which is 40. So baby one. So got one for everybody. So the way that you assess the size is to look at the opening of the mouth to the angle of the mandible. In general, it should be about that. If it's too long, it may occlude, and if it's too short, it may not do what it's intended to. Okay. And how these are placed, sometimes you can just put them straight in. Sometimes it helps if you kind of come in on an angle, and sometimes you even have to open the mouth if the tongue starts to slide back with placement of the oral airway. In this case, I'll just show you, this one goes in kind of easily. It just kind of goes just like that. And then once it's in there, you can really start to feel, in general, a much better situation in terms of getting air in with bag valve mask. These are invaluable resources and can be used in conjunction with a nasal trumpet. So if you're still having some difficulty, don't feel bad about putting something else in, okay?